Hi, I'm Dan Wang, and people call me Diane. I'm a registered traditional Chinese medical practitioner and a registered acupuncturist in Richmond Hill. I'm the founder of Harmonized Wellness Acupuncture and Herbs. And today I find a very interesting thing when I do pulse reading for a patient. And like today, because my pulse pillow a little bit far, so I just try to do pulse reading with one hand, like lie down on the table. Then patients say, oh, my wrist is not very comfortable. Then I grab the pillow and for the patient again. Then I notice, the pulse reading with the pillow, and it's more fluent and more natural and bigger compared to the pulse without a pillow. So I did some research then, and I want to find out why we need a pillow for pulse reading. Then I found four very interesting answers given by internet. Because when we learn traditional Chinese medicine, we always taught that you need a pillow. But we never really think deep why we need a pillow. And today is actually gave me an opportunity to look into it. Then I find some answer, then share with everybody. First, it helps the body to stay relaxed and aligned. If the wrist left hanging or bent, the joint naturally curves and the surrounding muscle become tense. The tension can slightly compress the blood vessel, making the pulse harder to feel accurately. By gently elevate the wrist with the pulse pillow, the forearm, wrist, and hand stay in relaxed, leveled position. This allows the circulation to flow more naturally, so the pulse reflects the body's true condition. Secondly, it's improve precise. In Chinese medicine, pulse diagnosis focus on three positions on the wrist: 寸, 关, 尺. Each position corresponds to different organ system. And when the wrist rests on the pillow, the bony landmark near the wrist become easier to identify. It helps the practitioner locate the guan position first and then accurately place the finger on the 寸 and the 尺 position. Third, it allows the practitioner to use proper technique and sensitivity. During pulse reading, 3 fingers are used, and the practitioner apply different level of the pressure, superficial, middle, and deep. If the patient's hand is unstable, the practitioner must focus on holding the wrist slightly. And with the pulse pillow supporting the hand, the practitioner concentrate fully on the subtle quality of the pulse. And finally, there's also a culture element. Historically, pulse pillows are made from material like wood, porcelain, jade, or decorate with traditional patterns. And they were not only medical tools, but also symbols of traditional medical setting. Placing the patient's wrist comfortably on the soft pillow creates a sense of respect and calm during consultation. So, although the pulse pillow is small, it plays an important role. It helps patients to relax, allow circulation to flow naturally, improve diagnostic accuracy, and let the practitioner focus on delicate language of the pulse. In traditional Chinese medicine, this small pulse pillow is not just a decoration. It's part of the diagnosis procedure in traditional Chinese medicine. Most doctors prescribe medication, but as a traditional Chinese medical practitioner, I also prescribe motion, Tai Chi, Qigong, and breathing, because many problems in the body are so closely related to the rhythm of qi and blood circulation. Thank you.